total vertebral column. Okay. Now the lumbar, you have finished the thoracic vertebra when you studied thorax. Now your abdomen will start already. Your lecture are arranged according to the in your classes, which will be naturally the lumbar vertebra is today's talk. Now, why I brought this skeleton in front of you? Because you saw in many of you, I took Viva. It will be like that, but you have to speak out. You have to identify the exact vertebra because it has its own significance in the vertebral column. See your cervical vertebra and your lumbar vertebra, sacrum, and total the hip. Now, with the cervical, the vertebra, this is in the neck, is supporting the skull. How many cervical vertebrae are there? How much? 7. Now, you see, and the vertebral body is small. But you see, suddenly you are walking, suddenly you do this and you pain there. So, but it is supported by the muscles. And these muscles, in the back, posterior, anteriorly, you see, the sternocleidomastoid. Over here, the trapezius muscle. It is inserted in the spine of the scapula. You just try to, now you have got the total idea of not straight away you're reading initially last 3 months or 4 months, whatever it is, you are reading, you gave an exam. Now you will try to, I say, why I got 2 marks or 5 marks, I'm not saying. But now you are exposed to the examination system, how things are asked in the table. Now you are exposed to that. Naturally, you have to orient yourself accordingly for your exams. This is one thing. Second thing is that, see, this cervical, this is thoracic, and this is the lumbar. Now, with this, you have to know the thoracic vertebrae, they are articulating with the ribs. That means it is having facets. But one common thing is that the canal which passes the spinal cord. Now you come to the hip. For 2 pelvic bones, 1 sacrum. It forms the hip, total hip, articulated hip. This is articulated. When in the exam, see, you are having all this like this. You are asked to hold one bone. Evolution of erect posture. You can see the brain size of this Australopithecus aliens, Homo labialis. This is Homo erectus, Homo sapiens, what we are. The brain size is 1400 cc, brain size 1300 cc, brain size 700 cc, brain size 380 to 450 cc. Now, how we have this Now line of gravity passes through. Line of gravity passes through. This is the line of gravity. This is the body of axis. Now you see just in front of the sacrum, behind the centers of the hip joint, and in front of the knee joint, and in front of the ankle joint. Now any deviation in a radiological plate, if it is like this, it can be hunched, it can be like this. You see people moving in roads, in stations, in marketplace, you will see some people are going like this. That means they are having some deformity that can be congenital, the birth in congenital, or it can be some from your disease, pathological condition, or the person might have sustained some injury, trauma, which was not managed properly. Either it can be that, or they could not afford, or like 20 years back, 30 years back, I'm saying, 35, not far, not 1000 years back, the orthopedics was not in modern orthopedics, and the orthopedics in our student age, there was no spine surgery. There was some belt support and this thing. Now, pathological conditions, I'm saying tuberculosis. Tuberculosis is a common condition where the abscess is there and then fracture is there. Suddenly it can become like this, or it can be like this. If it is a childhood tuberculosis, not managed by proper your splints and your drugs. Now, this is the center of gravity. You see the body and of the axis just in front of the sacrum, behind the centers of the hip joint, in front of the knee joint, in front of the ankle joint. This picture is taken from Grant's anatomy. Grant's anatomy. Now, vertebral column keywords. Vertebral column keywords. Parts of the typical vertebra and their function. Body, ossification, processes, and vertebral arch. Vertebral arch. Okay. Now, the parts of a typical vertebra and their functions. Typical, atypical. Now, typical vertebra, so what it will have? It will have a body, it will be having a vertebral arch, processes, and their ossification centers, you have to remember. Now, parts of a vertebra from above. This from Grant's. Now, the vertebral arch here, this is the body, this is spinous process, articular processes, transverse process. Composition of intervertebral foramen. Now, composition of intervertebral foramen, see the body of the vertebra, this is the lateral view, like this. You take it like this. Anterior posterior. AP, lateral view. So when you prescribe for a radiograph, then it will be anterior posterior and lateral. Okay. Now, this is the nerve. This is the disc, intervertebral disc. See over here, there are some cushions here. It is this duster material. That is articulation. During articulation, this is the best thing to replicate your intervertebral disc. When you come, you see in front. Okay, sometimes they put some plastic also. Now, proportion of bone and disc in pericircular parts of vertebra column by use of Toda's data. This is not. Now, development of curvatures of the spine. The thoracic and sacral curvatures are primarily cervical. Thoracic and sacral curvatures are primary. Cervical and lumbar curvatures are secondary. See, midterm. This is in the midterm. This is at birth. This is adult. Midterm. If you take a ultrasonograph, then you can see it. You can see the bodies, vertebral bodies. Is a very good machine, high resolution 3D machine with good probes in anomaly scan. Your 18 to 22 weeks, you have to make an anomaly scan. 12 to 13, 13, 14, you do an NT scan. Now, this with the event of the sonology, we are blessed, you can say. You don't, if any mother still gives some, they don't do the anomaly scan. Because anomaly scan takes a long time. Second thing, people, actually, you have to, when you are seeing, you have to educate your patient. Tell them, বাবু এটা এই সপ্তাহ থেকে এই সপ্তাহ এর মধ্যে ছবিটা করাতে হবে. Even due to our carelessness, I am also in that fold. We are from Durgapur, Ilambajar থেকে বোলপুর থেকে কটা পেশেন্ট আছে রে? নানুর স্যার 10টা আছে. ঠিক আছে, আমি দাঁড়াতে পারবো না. At least when you become a doctor, you must, if you cannot, you don't have the time rushing through chambers. 2 days you come from Kolkata, Durgapur, you are Pura Birbhum ghum liya. That's a new trend. And what? You miss the anomaly scan. Or you have done an anomaly scan, but you did not scrutinize the plate or the report. Small problems. It is that you miss means the person gives a birth to a congenital anomaly with different types of congenital anomaly. I delivered a hydrocephalus, was small. Hydrocephalus means the skull is overgrown. Now this cannot be accepted because I am telling you, I will be putting it up. I have spoken to Mollai sir. I had written just 9 pages on this topic, human congenital malformations and its correlation with animal malformation, goat, calf and all this. I have a very good collection. Few of the photos are not available in cloud, but I have to try. I have to take out that script and try to ask AI chat GPT. I'll be asking, On Friday, I will sit down and show this thing. And you'll get stunned when I put it up, or I will show you, I can show you also that how twins can come up. And now you see the homologous part of the cervical, thoracic, lumbar and sacral vertebra. Now vertebral foramen of T6 not larger than your ring finger. Now the second slide I showed you, the couple dancing. Then the boy took one vertebra and tried to put it into what doesn't pass. See, it is T6 vertebral foramen of T6 not larger than your ring finger. Try it today on this mala. When I give you the mala, Japo mala, Rudraksh mala, many malas are there. Okay, now T6, see, it doesn't, you try it, it won't pass. Okay. Now you see vertebral curvatures. This is important. The cervical secondary curve. This is the pharynx and larynx, mandible, vocal folds, trachea begins here. Again, the lungs, the dome of the diaphragm, the place of the heart is here. This is the sternum, aortic arch, thoracic primary curve, lumbar secondary curve, sacral primary curve. If you wish to take this, your camera, you can take it. Come, we get up, we have to come. Lower portion you got, sacrum. Sacrumটা পেয়েছো? পাছুটা পেয়েছো? তাহলে চলে এসো এখানে। পরে নিয়ে নেবে। একটা তুলে নাও, নাহলে একজন এসো, শেয়ার করে নাও। একজন এসো। এই তুই একটু কাছে থেকে নাও ওটা। একটু এরকম করে দিন। Because see, if you see the level, you take in the phone, then you go and draw, and you label it. At what level the trachea starts, this comes. Naturally, it's a very good illustration. Now, compression of spinal nerves. This is the MRI. And you can see the compression, the vertebral. এগুলো এত ডিসগাস্টিং না? Yeah. See, this is MRI, and you can see the spinal stenosis here. This is the sacrum, the lumbar. The disc prolapse and stenosis is there. In MRI, you will get it. Now, you will find surgery. Now, see, lumbar puncture, spinal tap. That can be a short note. What is the spinal tap? What is the spinal, your tap? It's like you are any patient. Patient means a baby, it can be an adult, it can be. So, you have to do lumbar puncture. When you are an intern or when you are a student, you high pyrexia and signs of this thing, your neck stiffness. If it can be adult, it can be meningitis or encephalitis. For all these conditions, you have to do a spinal tap. Send that fluid to the lab and they will do biochemistry, then microscopical examination, and they will give you the diagnosis. These used to be performed in my father's age also, but those spinal needles were thick and they had to reuse, means stainless steel or brass nickel, mota. Okay, next day I'll bring that needle. Now that they push in between your spinal anesthesia. For it is a very safe, and either the patient is made to sit with his or her legs stretched, and like this, they select from L1, L2 according to what type of surgery will be done, and the lower portion is anesthetized. Even from upper gallbladder operations, they do a spinal, they give a medicine inside and slowly, pa bhari hocche, are you feeling heaviness of the limb, your lower limb? Patolo, but no. Okay, then again, after the operative procedures are done, or LUCS even, the spinal anesthesia is being used. Of course, if there are some difficulties or some condition is there, then do an intubation, general anesthesia under nitrous oxide and your this thing. Now you see, now and see the holding the tube. This is for your spinal, tapping the spinal fluid for some pathological examination, biochemistry and microscopical examination, and in lumbar this thing puncture, and in your for anesthesia they put a drug and a beautiful disposable that these needles. This is your little bit of blood. Sometimes what happens, press directly, you miss the canal or something. The small vessels are there, so that gets in. Then you pull the syringe, there's blood. Then you change your position. You have to put it in the not in blood vessels. If the blood comes, you have to change position. Now, spinal column. Now, due to disease conditions, scoliosis, kyphosis, all these terms, it can be a short note or spinal tap. Okay. Coccydyna. Now, you see how the fracture of the cervical spine is supported by the plate and screw. Ekdam. See, this is one thing. Now, why these things happen, the road traffic accident and all. You put a collar temporarily when you are shifting. Ultimately, after an MRI and other investigations are done, then they have to take a decision, should I immobilize? Previously, plaster is to be done up to like this. Roman films and all, you see armor like that. Even in Cox, your spine, Cox spine, there's a tuberculosis spine, there's a jacket like Agdam. jacket. Immobilize. Take drugs and wait for 6 months, immobilize. 3 months according to the severity of the condition. Now, caudal anesthesia. This is this is done for any small procedures like operation of the piles, operation of the fistula, this saddle block, we say. It's called saddle block. Okay. Now, vertebral venous plexus, Baxton's valvulus plexus. This can be a short note. Baxton's valvulus plexus, vertebral venous plexus. It has to do a fracture vertebral body. That's fracture vertebral in spondylolisthesis, lumbar 5. Now, this spondylolisthesis, these আমার spondylitis আছে. If the doctor says you have to go for a neck pain, it is even we don't explain to the patient. না আর কি হয়েছে ডাক্তারবাবু কি হয়েছে? What's wrong with me? না spondylitis হয়েছে, বাস ঢুকে গেল। But even she's না আমার spondylitis হয়েছে, আমি বেশিক্ষণ কাজ করতে পারি না। So it goes into the head in such a way that you have to do a psychiatric consultation. So, spinal dysplasia, cauda equina of the sinus. See, there's a cauda equina, the sinus is there. Scoliosis, see, I showed you. See, one thing, your MRI, CT, PET scan, but most 300 rupees or say 2,000 rupees. In 300 rupees and one your radiology plate, they charge you 300 rupees. And ultrasound 1,200 to 2,000. तो ब्लड टेस्ट एंड ऑल 4,000 रुपया में आपको डायग्नोसिस यू कैन मेक बाय ऑल्सो यू एड ऑन इज योर क्लिनिकल नॉलेज. नाउ सी around last year my elder sister, she had a just fracture of the vertebral column, two bodies, but slight. You have a plate screw and all this. I told her at this age, you don't go for spinal surgery or anything. You put a belt. I put the belt and she wore it. Now she can move herself. Now this have to be judgmental. Modi card and Didi's card. Now 5 lakh. Now we doctors, some doctors malpractice. Anything orthopedics, big package. You have to give one small fracture of a 75 years lady, fractured collis. outstretched hand fell down. You just have to hold it and this. Only plate lagana hai, screw lagana hai. Oh, it's gone. Now, what I'm telling you, this judgmental. Now, you see, according to the corporate hospitals and according to this thing, I'm not thinking of the corporate hospital. How many people can afford? If you don't have a card, then how many people can afford? But you have to give treatment. You don't know who's having money in the ATM. You don't know. You do your job. Right. You do this thing. Refer to a hospital. Now, see the scoliosis. Now, congenital spinal malformation. This, what I told you, anomaly scan. You must do. So, from 18 to 22 weeks of pregnancy, that means second trimester, you abort it. Suggest. You might be a general physician. You might be having a DNB in gynecology. DNB, whatever it is not that. You are plain MBBS. You have not taken an online degree. So your duty is that when you are practicing gynecology or you are seeing a patient, you suggest one ultrasound. Now, after one ultrasound, around they usually come Kadina's test, not Corona's test. ডাক্তারবাবু দুটো লাইন পেয়ে গেছি। Yesterday, I did an MTP. The lady had a previous birth with, she has a VSD, ventricular septal, small, some 3 to 4 millimeters. With that, she was delivered by LUCS, and again she got pregnant. I told her, that's why I'm not coloring now. I'm leaving it white. Why you are knowing, the doctors told you, be careful taking the second child. Why you, আমি এটা নষ্ট করবো, I want to do an MTP. Again, I did the ultrasound and then it was just 5 weeks pregnancy. And I did it. Now, why I'm telling you, I have at least given anencephaly fetuses, even this spinal, and conjoined twins in Vertebral Medical College. If you have the chance to go or you become some professor there, when you pass out, you become a professor. You visit the anatomy museum. In those days, I used to carry specimens in the train. But nowadays, they'll catch me. And I'll be viral. But yet, I have brought many things here. But nowadays, these things are becoming rarest. If at all, some child gives this type of birth with a spina bifida and this thing. Actually, if you do an ultrasound, anomaly scan, then you don't expose the mother and the fetus in X-ray, radiology, because mostly they are cartilage. It won't be viewed in such form. Okay. Now, this is a picture. Now, see how these injury occurs. Flexion-rotational injury. He is carrying a load and suddenly he slips and he is having this type of injury. This type of injury. See, nowadays in small flats, what you have place there, you have a loft and this thing, and things are there, small, let's say 1000 square feet, 750 square feet. Now you get nowadays these ladders, you push it and fix up, folding, this type of, but you mind it when you are handling things, or your mother, Amazon se la diya, birthday gift. Don't let her climb that, you climb. Because if you fall, there will be this type of catastrophe with a, see it is like the vertebral is looking like a maxilla and mandible, a portion of the skull. Now see, flexion injury mechanism. Dum patas. Okay. Now yeah. Key long drive from Salt Lake or Rajarhat Newtown. Chalo, masti, second bridge, and people are chasing. When you are in a car, people are chasing you. With a motorbike, midnight, 2 a.m. Then suddenly one guy, he wants to be a hero. He takes his motorbike and like this and comes in front of you. Then this type of catastrophe can happen to the man who is driving. The man who comes in front of the vehicle, I'm not talking about it, but you see how you get it. Of course, I sit in the front seat, but I don't know how to drive. But I even don't, Bolpur and this thing, when I come, I don't wear the seat belt. I mean, I don't have the habit of driving. But as I enter Kolkata, I try it because I'll be fine. At least what they'll say, Dr. Babu, you know, biryani, Royal's biryani. So I told him, you see, I am from a village. Biryani, Royal biryani to lagbe ekta. Ki number plate, this was dismantled. But I had it in my dicky. And this incident happened. Now say, তাহলে তো আপনাকে কেস দেবো। আমরা কেস দেবো মানে আমি যাবো চলো। So the royal biryani at a royal biryani. So that reminds me of Royal's biryani. You know Royal, a restaurant in Kolkata. Their mutton chop and tandoori roti naan is very famous. Very famous. If you, I will suggest some holiday you go and take in these joints, food joints in Calcutta. No, not the modern joints. But your seat belt is not. This is an aeroplane seat. They tell you, the air hostess comes and demonstrates you have this, that, this. So you try the seat belt. This is chance factor, fracture. Now you see Auckland's video. I think when you came to the college, I told you, if you, this is a movie. This second, the continuous part is the movie. Okay. Now, one thing I tell you. You just pass it out. When you see the orientation, and individually what you have to do is that when you next day, whatever class I will teach you, then you take the vertebrae. Lumbar vertebra, sacral vertebra, and your parts. And just revise thoracic. Lumbar vertebra does not show this thing, but cervical vertebra, many contents are there.